This is part 6 of the series of sulfur and your microbiome health. And I'm going to talk about something that I get questions about on a daily basis. What if I have a sulfa drug allergy? So let me say this really, really clearly. They're not the same thing. A sulfa drug is a sulfonamide, which is a complex molecule that does contain some sulfur as part of its action. Sulfur itself, which is a tiny little piece of the sulfa drug compound, is essential to life, right? So if you had an allergy to sulfur, well, first of all, I don't think that's even a thing, but let's say you did have an allergy to sulfur, you wouldn't have left the hospital as a baby because it's not compatible with life. There are some genetic defects, very, very, very rare, where someone is born and they can't process sulfur. They don't leave the hospital. So everyone needs sulfur. Everyone can process sulfur. A sulfa drug allergy is not the same thing. So let's divide that up a little bit into some manageable sections so that there's a better understanding with it. Right? So some of the things that can happen with sulfur is you can have a sulfur intolerance, meaning that you have to gradually increase your dose to be able to upregulate your systems and tolerate it well. You can have a sulfite allergy. That's a form of sulfur that your body is able to convert using the sulfate oxidase, which is dependent on molybdenum and selenium as cofactors. So the sulfite oxidase is going to oxidize sulfite to sulfate to get it out of your body. So you can have two things happening with sulfur. You can have a sulfite allergy. You can have a sulfonamide allergy. And you can also have a sulfur intolerance. Sulfur intolerance is mutable, it's not permanent, and taking in sulfur in the form of MSM or methyl sulfonylurea is not the same thing as giving your body sulfite or a sulfa drug. Okay, so hopefully that clarifies this a little bit. For people who are concerned with it in terms of, what you're taking and what the reactions that you may or may not be having are. So one more time, just to drive it home, sulfur is an essential sulfur is an essential mineral, and we cannot live without it. You can't be allergic to it. It's not possible. Okay, so sulfa drugs are sulfonamides. That includes the antibiotics that have sulfonamides in them, thiazide diuretics, loop diuretics, sulfonylurea, and carbonic anhydrase inhibitors. So those are the categories of drugs that contain sulfonamides, and allergies to these sulfa drugs are common. They're not the same as sulfur. Sulfites are naturally occurring sulfur molecules that are produced during fermentation, and they're used as preservatives in food. So you'll find those in foods like jams and pickled foods, soup mixes, gravies, canned vegetables, baked goods, and wine, right? So they're produced in that fermentation process, and they're also added to foods as a preservative. So some people do experience reactions to sulfites when they have them in their foods. Sulfites are not the same as sulfates, and they're not the same as sulfur. Sulfur is the element. Sulfites has a bunch of stuff added to it, and that's not going to happen to a large degree if you just put that into your body. So you might be upregulating those pathways again You might be upregulating a pathway of sulfites if you take sulfur, and then we can work with that to make that not happen by helping your sulfate oxidize enzymes do what they're supposed to do to change that sulfite to sulfate so you can pee it out and use it in your body for various transport mechanisms and all the other wonderful things that sulfur does for you. So that's definitely something that's easy to work with, and I think essential to work with because you need that sulfur. All right, and the sulfates are salts of sulfuric acid. They're found in some supplements, medicines, and personal care products. So sulfates, the really one that nobody reacts to. You're going to find those in various things that you use. Sulfur is an element, find it on the periodic table, that is essential to your health. The sulfur-containing nutrients include methylsulfonylmethane, MSM, allicin in garlic, alpha-lipoic acid, glucosamine sulfate, SAMe or S-adenosylmethionine, chondroitin sulfate, and also antioxidant and protective molecules like glutathione for detox, dimethyl sulfoxide or DMSO, and N-acetylcysteine, which seems like the kids are calling NAC these days, N-acetylcysteine. So all of this contains sulfur. All of those are ways that you can get more sulfur in your body. And my preference is obviously the methylsulfonylmethane or MSM, because that has proven itself over and over again over the years to work for these microbiome imbalance deficiencies that result in symptoms like gas and bloating and abdominal pain. Also, diarrhea and constipation for my patients. So we'll move on next to just really drive this point home about the difference now between sulfur intolerance, which is something that you can work with to change, versus a sulfite type of problem or a sulfonamide drug, sulfur drug reaction, right? They're all different. You can't intermingle them to the degree that they're going to be causing symptoms for you.